Today I'm going to be talking about the process of assessment in special education. My name's Daniel Bolton, and I've been teaching science for the Forber School at Glendon for 3 years. Today we're going to discuss what is assessment, how and why is it used, and what are the processes involved in assessing the areas of intelligence, academic performance, language, perceptual functioning, behavior, physical development, and social emotional functioning. Why do we use assessment? Well, it provides information on the functional ability of students in the environment. We can use it to diagnose problems, monitor progress, determine strengths and needs, make decisions such as for services for students, on placement. We can also use it for selection. In special education, it's required by law under IDEA, and in a broader sense, testing is required under ESSA 2015. So assessments have to be used ethically and responsibly. You have to use multiple assessments to qualify an individual as eligible for services under IDEA. So the first part we're going to talk about is assessing intelligence. It's a controversial issue, but most of the standardized tests, they're norm referenced and they've been used for a long time. The companies have worked really hard to preserve their validity and reliability. Some of these tests include the Wechsler Intelligence Scales, the Kaufman Assessment Battery, Stanford-Binet, Woodcock-Johnson, Differential Ability Scale, Comprehensive Test of Nonverbal Intelligence, Universal Nonverbal Intelligence Test, Test of Nonverbal Intelligence 3rd edition, and the Wechsler Nonverbal Scale of Ability. And these tests not only assess behaviors, but academic achievement and performance. The process involving assessing intelligence includes a screening. Usually it's problems noticed by teachers or parents, and then consent's given for formal testing, and then a referral is made to have the testing done. The results are interpreted. Usually you get a report, and then you have an interdisciplinary team that meets, and they're usually made up of teachers, the parent, sometimes the student, mainly trained professionals. And for intelligence, you'll have a special educator, psychologist, psychiatrist, and other service providers as needed. Before testing, it's a good idea to get to know the student, maybe look at some historical records, grade levels, or classroom achievement. You also want to look at the chronological age of the student and take into consideration the socioeconomic background and cultural backgrounds that might influence the type of tool that you use to assess. The main value that you're given when assessing intelligence is the intelligence quotient. So you're going to use multiple tools to develop an IQ score, and then you're going to make decisions based on that. You can't make decisions based on solely an IQ test. It wouldn't be ethical and it wouldn't be legal. But but it should be used in conjunction with other types of assessment. So some of the tools that you can measure academic performance include curriculum-based assessment, and that can be norm-referenced. It makes it easy to compare with individuals in a specific class or grade, sometimes even a school or small group. And you can also use commercial standardized tests, kind of like PARC, and that allows you to compare larger groups uh, across the state, district, or nation. And academic assessment's useful for gaining information about achievement, screening, aptitude, and diagnosis. So I'm going to talk a little bit about the different types of academic performance assessments. And you can have curriculum-based assessments, such as teacher-made tests, student products, direct observations, or oral questioning. This group is good for monitoring progress and assigning grades. And you have your commercial standardized tests of achievement, such as the Woodcock-Johnson, the Kaufman, and Wechsler. And they're good for establishing baselines and diagnosing problems. So again, just like intelligence, you're going to screen. Somebody's going to notice a problem. Then you're going to receive consent. You're going to refer to the special educator or psychologist or a related service provider for testing. You're going to have the test performed and interpret the results and meet as part of an interdisciplinary team. Again, if you're going to administer the test, get to know your students and determine the type of test. You want to make sure it's culturally appropriate and it's appropriate to what they've been learning. And after the test, you're going to want to give feedback. And for a lot of academic and curriculum-based testing, you're going to have grades and grade levels. Academic performance decisions include establishing a present level of performance. You're going to maybe look into RTI strategies until all of the comprehensive testing is done, and then maybe determine eligibility for an IEP or a 504 plan. The next domain we're going to talk about is language. And language is the ability to communicate. It can be expressive or receptive, and language bridges multiple areas of a person's functioning. So according to Overton, language assessment entails measuring verbal concepts and verbal understanding. Some of the tools used are listed here, and you're going to look at verbal comprehension and expressive vocabulary. You're going to want to look at morphological completion and syntax and word ordering, spoken, written, and general language. And these are useful for screening for disabilities that may be physical in nature or related to disorders such as autism spectrum disorder. So again, language assessment occurs in early childhood most often, and it can coincide with other disabilities such as vision or hearing problems, so those should also be assessed. Like any other assessment process, you're going to screen. Somebody's going to notice a problem and always get consent, and the people involved are going to be parent, teachers, maybe a speech and language pathologist, and an otolaryngologist, fancy way of saying a doctor that understands the mouth and the throat and the ears. So before testing, you're going to want to meet the student, look at historic reports, determine if there are physical impairments or other developmental delays, such as vision or hearing. During and after the test, you're going to interpret the results and give feedback or report suggesting interventions to the team. And the decisions you're going to make again are eligibility for service, placement, accommodations and supplementary aids, a medical consult if needed, and speech therapy with a speech and language pathologist. Related to language, we're going to look at perceptual functioning assessment. And this is really used if you suspect a child might have autism spectrum disorder, which is a communication disorder. The delays are usually evident during early childhood from 0 to 4 years old. They may be diagnosed later due to other circumstances. And most of these tools include rating scales and parent surveys. So here are some of the tools that are used to help with perceptual functioning assessment. Again, this is not an exhaustive list, but a list of very common tools that are used. They include a test of visual perceptive skills, and they test form constancy, spatial relationships, sequential memory, visual closure. That's for visual perception. The Gilliam Autism Rating Scale tests communications, and it's perceiving language. Stereotyped behaviors, the PDD behavioral inventory, sensory and perceptual approach behaviors, specific fears and ritualisms. Ritualisms are really, really common in people with autism. Childhood autism rating scale, that's used earlier on, and autism diagnostic observation schedule. Test for communication and reciprocal social interactions. Again, autism heavily impacts a person's ability to function socially. And the autism diagnostic interview, and it's more of a clinical interview and provides a medical diagnostic for autism spectrum disorder. And again, the process for this includes the screening. Somebody notices a problem. It's often a parent or daycare provider, maybe a preschool teacher. Then there's some sort of screening and consent before a formal referral is made and testing begins. The people that will be involved with this process will be teachers, parents, a special educator. The parent and guardian or the student can give permission for testing as long as the student's of age majority. You're going to have your trained professionals such as SLP and OT and your psychiatrists and psychologists and the rest of your interdisciplinary team as required under IDEA. So the events before testing, it's really important to get to know the student before you test them. You're going to want to look at any historic data. Make sure you're following all the testing manuals and IEP if there's one present. You're going to also screen for multiple coinciding disabilities such as ADHD or depression. You're going to interpret your results and give your feedback. With the decisions, you're going to make an eligibility decision. You're going to maybe decide on placement. Is public school the best place for them? If it is, will they attend all their classes in public school or some outside? You'll also decide on proper accommodations and supplementary aids. a medical consult if another is needed, and then you're going to provide speech therapy with an SLP or an occupational therapy or occupational therapy with the OT. And they're really important because they can help with the communication piece and the sensory issues that usually co-occur with autism spectrum disorder. The next area we're going to talk about is behavioral assessment. And behavior, it's a form of communication, and it's any observable and measurable action in response to a stimulus. Schools are required to assess for behavior and adaptive behavior under IDEA, and they're supposed to determine if a student is having a lot of negative behaviors, if that behavior is a function of their disability or a manifestation of their disability. If a student with disabilities is having a lot of negative behaviors, it might be a requirement to have a manifestation meeting to see what can be done about it. And again, that's required under the amendments of IDEA 1997. Some of the models that are used to help manage behavior on a larger scale are the RTI models and PBIS. And PBIS works by increasing positive behaviors. It's a reward system. It's usually school-wide or small group. It can be tailored to the individual too. RTI model is very similar to PBIS, and it's a three-tier model, and it establishes ways to remediate problems. So your tier 1 is going to be your general school rules and policies or district rules and policies. Your tier 2 is going to be specific interventions geared to smaller groups, such as a class or several students. And then you're going to have your tier 3 interventions, which are more intensive and are geared towards the individual student. Some of the tools that are used for assessing behavior include a functional behavior assessment, and they're comprehensive. It looks at both the student and the environment. And some of the methods used are direct observation. And most of the recording models follow the ABC model, looking at the antecedent, behavior, and consequence. So observations can be made by teachers, clinicians, or trained paraprofessionals. Here's a list of several different tools that are used for behavioral assessment. They include checklists and rating scales, parent-teacher report forms and interviews, and some examples are the child behavior checklist, the Achenbach system, behavior assessment for children, behavior evaluation scale, behavior rating profile, and the Connors rating scale. And they look at different things such as the intensity or severity of behaviors, whether behaviors are positive or maladaptive. Some can diagnose ADHD, depression, or progress with adaptive behaviors. Some diagnose for interpersonal difficulties, unhappiness, or inappropriate behaviors and learning problems due to behavior. Other ones deal with perception and feelings, and some can diagnose for ADHD and coexisting disorders. So the process, again, like every other areas process, you go through a screening, there's consent, and then a referral, and then formal testing only after consent. You're going to have your teachers, your paraprofessionals, your parents, your guardians, the students going to be involved. You might have social workers, psychologists, and behavioral specialists as part of the interdisciplinary team. So before testing, you want to get to know the student, look at historical data, maybe behavior reports or office referrals. You're going to determine if the student already has a documented disability, because that can change the way things work, um, and, and might trigger the requirement of a manifestation determination. During and after testing, you're going to follow all the manuals for your testing tools and the student IEP, and you're going to interpret the results and give some feedback in the form of a report. So, as part of the functional behavior assessment, you're going to decide on the eligibility for an IEP. You're going to look at different goals and objectives for changing the behaviors. You're going to develop a behavior intervention plan, and you're going to, if necessary, if the behaviors are dangerous or unsafe, look at the crisis intervention forms that you have to sign as part of the IEP when it comes to physical restraints. Some considerations mean that we have to look at the least restrictive environment for the student when we make our consideration for placement or environmental factors. Next, we're going to talk about physical development. And physical development includes any of the biological functions and growth and formation of the brain or eyes. Includes vision, hearing, growth, orthopedic disabilities such as scoliosis or anything else that impairs the formation of the limbs, TBI, traumatic brain injury, and this does fall under the category of developmental delays. And these are assessed early on usually. It is noteworthy that physical developmental problems, they can coincide with other disabilities, so you might see them coded as multiple disabilities on their IEP if they have one already. So problems with physical development are most often diagnosed by a doctor. There's a formal medical evaluation, and then the information is presented to the team, and appropriate accommodations are made under IDEA. So for social emotional functioning, it includes the ability to form healthy relationships, to manage emotions, to express feelings appropriately, and if there's a problem, it falls under the category of developmental delay. And there's a very large impact on academic learning. Some of the tools that can be used are the behavior and emotional screening system, and it looks for the student's ability to internalize and externalize problems and their adaptive skills. The next tool is the social skills improvement system, and it's a pro-social skills program. It's motivational, and it is useful for developing and monitoring progress. We have the Devereaux Early Childhood Assessment, and it assesses self-control and attachment issues. And there are tons of other tools that can be used. I found some on the pbis.org website under the Tier 3 interventions page. And the PBIS website is great. It's set up by OSEP. It's a group under the Department of Education. So again, our process for assessing includes a screening. We notice a problem. either a parent, teacher. It happens early on, usually uh, during early childhood. We again get consent. There's formal referral, testing, then we meet again to interpret the results. You're going to have teachers, parapros, parent, guardian, the student can be there. Uh, Most often, you'll have social workers, psychologists, and behavioral specialists as part of the interdisciplinary team. Before testing, get to know your student, review the historical data, and during and after testing, you're going to give suggestions for interventions. Can determine eligibility for service under IDEA with some of these testing. Under emotional disability, oftentimes they're coded as multiple disabilities due to coinciding disabilities. And some of the behavior interventions that can be put in place include FBA or BIP. And there's going to be quarterly progress monitoring and therapy, and that can occur individually or as part of a group. In summary, assessment plays a large part in special education. It's required under IDEA. It provides valuable information about students. It's useful for making decisions about education. And the people that use assessment in education include teachers, special educators, clinical psychologists or psychiatrists, social workers, speech language pathologists, OT, and other related service providers. And using assessment data can lead to effective interventions and increase positive student outcomes. And here are my sources. Assessment is the process of gathering information to make decisions or monitor process. And it's made up of tools, processes, events, decisions. And it's used by educators, therapists, doctors, and other related service providers.